Well, we are very happy to have this chance sitting together and share your experience with us and with our patients. Okay, Diva, can you first make a brief introduction about yourself?
Yes, I am Deva Balendran, 55 years old. I am a Canadian, originally Sri Lankan but Canadian citizen. I am 6 years ago, my urine got to protein. I take a medicine in Canada, but that time menopause also a problem. I take that one. After protein going fast, that's why I don't proper eating, proper lose weight, everything. That's why I take a medicine, prednisone, gaining weight, so much problem my body. My husband searching for the treatment, so many countries, find out China. My children are medical students, and that's also helping for me. Finally, my husband decided sending for China in Jiajuan. I am coming. That time, very, very low condition I am coming here. Loose motion, vomiting, fever, no proper food, everything. Disease also, so many things. Finally, I am coming here, treatment, Chinese treatment, Chinese tradition, treatment, everything I got. Day by day, I will grow up. Right now, when I came here, 357 creatine level. I eat only 2 slices bread. I can't eat anything. After 45 days, very good. My creatine level 127. My face is so beautiful. So my family people, everybody like it. Everybody believe it. So many people coming. Second time I also coming, the booster stem. Right now also I got a stem. I am happy.
Well, this is your second time you
Yes.
come to China, right?
Yes.
So before you come to China, why did you decide to come to China again?
Yeah, my husband searching for treatment, which country good for everything. But Mexico is a 2-3 days only stem cell. But here I stay hospital, Chinese treatment, herbal, acupuncture, everything helping for. That's why he sent it here.
So this is the second time. So
Yes.
before you came to China, how is your feeling, your appetite, your
Yeah, I'm vomiting, fever that time. Okay, now is everything very well. I got a treatment.
So now do you feel
Best.
best?
Yeah, breathing level, everything best.
Okay.
Because maybe before you came to China, right?
Yeah.
So you may have some doubts.
Yeah.
You may have doubts. Understand what attracted you to come to China?
Before I don't know China and China people. My husband, my children, my people are sending all good, otherwise coming. But I am everything here. I am satisfied, perfectly satisfied. Your treatment, your medicine, you behave, everything I like it.
Well, last time you came with your husband, but this time you came alone, right?
Oh, yeah.
So during these days, who take care of you?
Yeah, my country people here, but I believe I know how to manage. The first time I am coming, I see everybody, you are friendly, you see me everything. That's why I am coming. This is look like mother home.
Okay. So your nurse is Phoebe, right?
Yeah, baby.
So
My daughter, she don't know, but she like her auntie. Every time she tell baby, my auntie.
okay. So this time you came alone. So Phoebe takes care of you.
Yes.
Usually, right?
Yes, that's why I am coming alone.
So are you satisfied with Phoebe?
Yes.
So who cook for you and
Yes.
who bought the food for you?
Yes, everything and myself.
So right now I'm going to ask some question regarding Mala's condition. Okay,
Yes.
so first of all, Kansan, I want to ask you how you found the treatment in our hospital.
Yeah, it is my pleasure to be here and to have my wife. Is you all call Mala. Her name is Ratna Mala. My name is Paula Gandha. You call me Kandan, right? My wife has the renal problem, being pretty much 3 years now. She's been over 2 years in dialysis. I tried to have all the treatment, what the best treatment in Canada. If anything, like whatever I can have it, like either transplant or donation or whatever it is, that I was looking to there to have her, because her condition is gradually getting worse and worse day by day. One day, I think it's about 4 months ago, accidentally, I saw Devaga husband Balan in the movie theater, right? And he was chatting with one of his friends, a long-time friend. That friend and my friend also, and also he is one of my family friends, and also his wife, Mala, relative. So when we see all together, and my friend, which is a Bala friend also, Bala talked to my friend and his friend to have how they have a sickness and how she get the treatment, how his health condition. So that time my friend introduced to while I'm walking there, and he called me and introduced Bala. Okay, and then I think it's the same problem what your wife has it. So check with him how he's been there and how what's the medicine, what kind of treatment he have it. So at that time, and Bala gave it to me the phone number and call me and we'll talk to you. And also he's give it to me some website address to go and look at what kind of treatment. So I went there, and after 2 days I called him and he gave it to me more details. Then when I got those details, and I came home and I gave it to my son, and he's now around, next week he's 18 years, and he's studying science and he want to become the doctor. So when I give it to some details about the treatment what the hospital provided, and he asked me, oh, Dad, this is good treatment, and plus the herbal treatment and all these things, and he encouraged me, okay, better we can have it and go and check out. So the same time, and Bala come to the China for some other reason, and he called me and he said, I'm in China right now with one of the other friend from India. She's 12 years old kids. She was a kidney failure and she was getting treatment here. Why you don't come in here and talk to the hospital experts?
So that is to say, Diva, she has received effective treatment here. After that, Diva's husband, he is the one who introduced you to come to our hospital,
yeah.
Right? So could you please tell us some basic information regarding your wife's condition? I mean, before she came to China, how is her condition? How her condition is?
Her condition was, to me, it was so bad.
Mm-hmm.
Like her condition is like I think creatinine level is is up and down. It's before dialysis and after dialysis, and it's being somewhere around 900 or something like that. The creatinine level, and also she have a soda breathness, and we didn't know lately, and she has some heart problem because
and also we want to know how much urine output she had.
Yeah, I guess she having a heart problem, and also she have stopped passing urine almost 1.5 years now. maybe 2-3 drops in a day, and in about 1.5 years she
So
don't.
how long this condition lasted? 1.5 years?
1.5 years, and she stopped passing urine, and 2-3 drops in a day, and that's why she have some side effect start slowly one by one add on. It came to heart problem, and very frequently, and she had a heart problem, not only a heart problem, she having a sort of breathlessness, and she having trouble to breathe, and we been 2-3 times emergency and hospital to check out. They say she have some fluid in the system, and they went to the last, just 1 week before I come here, she had admitted emergency, and they found out she has some heart problem too. And just before I come, I already decided to come in here, and I sent that report to in here before I come in, and the doctors found out, and she has some other heart problem because that's the one causing her sort of breathlessness. We decided, and we are here, and the day we are here, and first 2-3 days, and the doctors and the experts, they look at her health condition, they put it, diagnosed it, and all the tests, and come back, and they readjust all the medication what she taken, and I seen after 4-5 days her blood pressure start being controlled after readjusted all the medication what she brought, plus that and your herbal medications, and the treatment what she get it, that asthma therapies, and that Chinese herbal medications, it's look like start working at the beginning, and then she get the blood pressure being stable. It's still high, but it's not like what she was in back home, right? And she's in here right now and keeping stable between 130 over 80 to 160 over 100. In Canada, before she come in here, sometimes the blood pressure going up all the way 240 over 140. And sometimes blood pressure drop to 80 over 55. So it's always up and down, and it's not being stable anywhere. And that was the biggest problem she had it there. But since she came here, and after 3-4 days, after the in hospital in here, and the expert and the doctors, and they check out after test and everything, adjust all the medication plus with the herbal medication, I think it is really helping to being that condition, blood pressure being like a stable. It's still a little higher, but being stable.
So did you find any changes regarding the test report, I mean, after she received the treatment in our hospital?
Yes, I did, and the first initial test, and the doctor bring it to me, and so okay, this is the problem, and also like the BNT or something, that the heart, the reading at that, the reading for that, what she is a symptom of why she having that sort of breathlessness, and what is the symptom will cause something.
You mean NT-proBNP, right?
Yeah, NT-proB, and that was, and I seen, and it is supposed to be, and the regular person is 125 or between
155.
Yeah, but my Mala condition was minus 35,000.
Yes.
And I was so surprised, and in my back home, and they didn't find out, and they didn't let me. They may know the last test, but before I got the report and I come here, so when I go back and I'm going to check it. But anyway, it is after 2 weeks the treatment, and then the hospital has another test after 2 weeks how her conditions.
Yes.
And I seen that the heart condition from minus 35,000 is dropped to 18,500, is almost half. And her the urinage, and I think it's now about 10 days now, yeah, around 10 days, and she starts having urine now. It's
so
not
how is for urine volume recently?
the recently, and she started once a day, then twice a day. Now she pretty much 3 or 4 times a day. It's not like a great volume, but still, and the urine passing like after a year and a half, she didn't have a urine. Now she started doing, I think it's somewhere between 40 milli to 65 milliliter, and she having that urine. I hope, and that the treatment will be improved.
Okay, actually, we want to ask Mala, because Mala, you are the patient, so could you please tell us how is your feeling after you receive the treatment here?
Yeah, better.
Better.
Yeah, she kind of shy and she the language very well, but I check her every day and all the time. I'm being here, I check every single time. So how you're feeling and what is your different, and of course when she come in here, she can even smile, and she was, because of so badly that illness and suffering with all different illness, heart, diabetes, tiredness, nausea, like a vomiting, and she can eat properly. Now last 2 weeks, and I seen a lot of different, and she's eating now normally. Like it used to be, she wanted to something like only one item she can eat it. Now we cook different, and she eats everything's like not greatly, but she changing every day, and eating habit it changed now, much better than before, and her bowel movements being okay, and the blood pressure being good, and the urine, hope it will be increased, and before I leave from this hospital to home, and I hope, and the treatment, the way what she get it, and it will be make more increase that urine volume, and also that the heart function. I hope the next test will be come down.
Actually, that is the goal between Mala and us. At the same time, we just want to ask Mala, are you satisfied with the treatment here?
Treatment okay, I'm going.
Okay, yeah.
Okay.
Yeah.
So
And also first of all, I had to not first of all, I should tell before, the environment, the English words, environment, if you are sitting the couch in here, it has to be comfortable to you sit. If it's not comfortable, then you cannot sit properly, right?
yes.
So that's the environment. When she come to the hospital environment, the including and the people and the nurses and the doctors and that the staff, everybody, it's like you being like a family. So that make you you don't feel something different. Like you've been here, everybody come in here being so friendly, like a family. So that make mentally it help you to recover your illness. It mentally it make you different. Just come in to sit down and lie down that bed and take some treatment and go. It's not like a something like in here. It's everyone from that professor or from the professor to normal staff, the people who come to make up and set up the room, and everyone to being very friendly. That's the biggest.
That's why I am coming
improvement.
alone. Like mother house.
Yeah, we really appreciate. Yeah.
Yeah, that's a main part of the treatment. Like you can go to the doctor if you seen he listen and he just write the prescription to take this medication. That's not going to be help you, and you have to sit down with the patient, talk to the patient, and explain and positively. Then that make better than the medications that make like the patients recover quickly than medications.
Yeah,
Right?
and
So I can see that one in here, everyone, like even like the hospital arrange one nurse for the patient, and she really she look like that's her home, and she been all the time there, like especially Daisy, and she really looking after the room. Good.
Yeah, exactly. The maintaining stable emotion also helps a lot.
Yes.
Right.
Yeah, that's the biggest changes. Like everybody coming to happiness and talking to the positively, and if she have anything like she's saying especially that I know that lady doctor.
Dr. Young.
Dr. Yang. She say to me every time if she feels some tired and something like that, and Dr. Chang, she come in and she say okay, and she do like this, she
A nice lady.
but what it's give to her is mentally she is getting she getting stronger, and she feel okay somebody she's doctor and plus and she giving positively and staying beside to her and helping, right? So those are the things like really the hospital. I know I'm going to be a short term, and we are here for getting treatment. But one way to other, we will after the treatment, and we will miss here some of you.
So in your word, we just want to we sincerely hope Mala and Diva they will get well soon. So.
And also at the end of the video, we also want to know, do you have any good suggestions, advices for our treatment and services?
Okay, so far our like the first day of when I see the doctors and when I was talking about doctor, the professors and the directors, some people could think this is like expensive. We compare with what we get in our country. This is a treatment, nothing cost, right? In here, like this is the money versus life. So life is your important, your part. You come here, and for my experience with my wife, since the day one and what I seen, it's like a more professional, and I don't see like anything like I can make any suggest to in this hospital. Only the reason I don't find much so far. I don't find anything I can introduce to some suggestion to help this look like in here everyone to doing their professional and doing their best to treat the patients who come in here. I can't find anything like it's what we are here. I think we get it.
Okay, so Catherine, right now I want to ask you one more question because by the end of this video, we just want to know because for some of the patients before they come into China, they may have some doubts or questions. So So would you want to say something to them before they come to China?
You know, this is up to me. I made my decision because of my wife, and she having a kidney trouble. At the same time lately, and it's getting worse. So I made the decisions with the one recommendation, which is Bala, and he recommended, okay, my wife and she get better in the treatment what she get it in this hospital. So I don't have to have anything else because I trust Bala. That's evidence to me. Then quickly I visited here, and when I come here, I only been here 2 days. I am satisfied with the hospital and the staff and the expert who is in here, and also at the time I had the chance to speak to some of the patients and when I come in here. So I had some positive statement from those people. Then physically I seen what happened in this hospital and the accommodations and the environment on this hospital, and I like it. I made my decision to bring my wife here no matter what, because she's the one suffering. Okay. I'm nothing going to be loose, right? I needed to hear. I seen that the treatment, you know, the herbal treatment and the therapies and the acupuncture, these are nothing hurt like some Western medication. There was some Western medication they give the medication and they may saying, oh, caution, you may have some side effect, right? So it is not really side effect, the treatment what I get it here. So the people, whoever, and suffering this kind of situation, like renal functions, the kidney badly damaged, or if some people they found out, they test, they saying, oh, your kidney start slowly, your kidney function going down, better to have them earlier to make a decision to come have this treatment, because in personally and my wife, if I know this hospital 2 years ago, and I think my wife will be much stronger than now.
Yeah, that is to say the earlier the better.
Yeah, I think it's anyone. If anyone wanted, you know, around the world, and there are million people suffering with the kidney problem, but everybody can afford it to come here. But the people who can afford it, or if they want to make a decision, they want to have some good treatment and make up their mind early as possible. If the kidney function is related to the heart, yes, that one also I have a practical experience with my wife. She started with the kidney problem, then eventually she is now the heart problem too. Don't wait it. If you have any test, find out do you have some kidney problem, make a decision, come to have your treatment early as possible to avoid some other illness come to your body.
Okay, so all in all, on behalf of all staff of the international department, we sincerely hope Diva and Mala will get well soon. Okay.
Thank you.
Thank you.
行了，